the treatment of cancer often comes with severe side effects, potentially surpassing the challenges posed by the cancer itself, and in some cases accelerating the risk of premature death. Conventional methods like chemotherapy eradicate cancer cells, but indiscriminately harm healthy cells throughout the body, leading to adverse effects such as hair loss, nausea, vomiting, and a compromised immune system, making individuals susceptible to life-threatening infections. In contrast, an innovative cancer treatment has emerged, leveraging the inherent capabilities of the patient's immune system rather than suppressing it. This groundbreaking approach manifests as a vaccine specifically tailored to each individual after decades of extensive research. Typically, cancer cells evade a person's immune system because it is recognized as that person's cells. The company developed a tumor lysate particle-only T.L.P.O vaccine that uses a person's tumor cells to identify particular parts that are then presented back in the body using the vaccine in a way that can stimulate their immune system to gain the ability to detect these cancer cells like an infection, allowing the immune system to fight the cancer itself. Unlike traditional methods, this treatment addresses the challenge of cancer cells evading detection by the immune system, but after the vaccine, the immune system is able to recognize cancer cells as foreign entities. Consequently, the immune system gains the ability to combat the cancer naturally. Clinical trials of the T.L.P.O cancer vaccine have been conducted on hundreds of patients with advanced melanoma in Phase 2 trials. Encouragingly, recent data presented at an academic conference revealed that nearly 95% of individuals administered the vaccine alone remained alive 3 years post-treatment initiation, with 64% exhibiting no signs of cancer. Building on these promising outcomes, the Food and Drug Administration (FDA) has taken significant steps forward. 1. Approval for basket trials, which involve testing the cancer vaccine on various types of similar solid cancers. This clinical trials is already on. 2. Gave a green light for the vaccine producers to commence a Phase 3 clinical trial, spanning 3 years with the goal of enrolling 500 participants. The trial is anticipated to commence later this year. This Phase 3 success is essential to ascertain whether the T.L.P.O cancer vaccine will truly revolutionize cancer treatment. There are past instances where promising Phase 2 data did not translate into Phase 3 success. There's a cautious optimism surrounding this vaccine's potential. It is crucial to note that Phase 2 clinical trials are not conclusive, and the true potential of this cancer vaccine awaits validation in a larger Phase 3 clinical trial. Historically, promising Phase 2 results have not always translated into success in Phase 3 trials. Nevertheless, the current data from the Phase 2 trial of this vaccine suggest a good possible outcome. Before the autologous T.L.P.O vaccine can become widely accessible for treating melanoma and other solid tumors, it must demonstrate sustained success over several years in the Phase 3 clinical trial and receive final approval from the FDA for general use. Furthermore, broader application awaits success in the ongoing basket trial, followed by targeted clinical trials for other indications, a process that entails years of research and substantial financial investment. Kindly subscribe to our channel so that you can be notified anytime we release a new video with life-saving medical information, and don't forget to hit the notification bell. Note that knowledge is advancing by the day, and we will like to always post an update on new advances on how to stay healthy. You can contact us via the link in the description below for any medical inquiry. You are watching Zoom Hospital channel and listening to work of Dr. Carriorty.